Hello, everyone. Welcome to Why Research Matters, a conversation with Operation Smile Global Surgery Fellows Dr. Zach Collier and Priyanka Naidu. I'm your host, John Streit, our managing editor and writer, and also on the line is Amanda Lichtenstein, our digital content manager. Welcome to our event today. So this series is really all about introducing our audience to the work of our Global Surgery Fellows in research and innovation on behalf of Operation Smile. Before we meet Priyanka and Zach, I wanted to offer a little introduction about the Global Surgery Research Fellowship. So this program is the organization's response to the belief that a critical part of creating a future where access to safe, affordable, and timely care is available to everyone. That's to cultivate the next generation of global health leaders. To promote this mission, we've developed the Global Surgery Fellowship Program, which gives young medical professionals long-term opportunities to expand and enhance their global health knowledge and expertise. The fellows are fully integrated into Operation Smile's work and gain exposure to research, advocacy, and on-ground programmatic initiatives in the low and middle income countries where we work. The organization can also utilize the knowledge of young, brilliant medical professionals to improve our programmatic education, research, and innovation initiatives. The current cohort has 10 fellows on 3 continents representing a diverse set of geographic and professional experiences. And thanks Priyanka and Zach for joining us today. We're so happy to have you. Priyanka is a medical doctor and aspiring pediatric reconstructive surgeon from Cape Town, South Africa. She studied at the University of Cape Town and went on to train at one of the world's largest hospitals, Bara Hospital in Soweto. Since joining Operation Smile as a Global Surgery Fellow in February 2020, she has been involved in education and training and health system strengthening initiatives and geospatial mapping of cleft care providers in Operation Smile's programmatic countries. Welcome, Priyanka.
Thanks, John.
Yeah, no problem. And then we have Zach. Zach is a current plastic and reconstructive surgery resident at the University of Southern California, where he has completed 3 of 6 years of training. Since joining Operation Smile, Zach has worked on a diverse array of projects related to surgical education and simulation platforms, volunteer opportunities and engagement, nutrition assessment and optimization, burn care and training initiatives, and social media platforms for education and research divisions in support of Operation Smile's 40th anniversary. Welcome, Zach.
Thanks for having me. Pleasure to be here.
Yeah, no problem. Great. Well, let's dive right into it. Zach, what inspired you to pursue a career in medicine and what attracted you to the specialty of reconstructive plastic surgery?
Thank you for that. Yeah, it's been a bit of a roundabout and long course, but it really started back in college. I actually was a neuroscience major. I had fallen in love with the study of neuroscience. I felt it was like this exciting frontier in human anatomy, and a lot of the research I did at that time was actually in mental health issues like post-traumatic stress disorder and other mental health related diagnoses. And then from that, I really started to think of a career within medicine, and I kind of had been around medicine most of my life. My parents were both dentists, and many of our family friends were physicians. And so I approached my parents and asked for, if there was some opportunity to be exposed to other areas within medicine. And they happened to know a plastic surgeon back home in New Jersey, where I'm from, that did a lot of reconstructive work, specifically taking care of patients with significant injuries from burns and trauma and cancer. And I actually ended up spending 2 summers with him, really learning an incredibly amount about what plastic surgery really was, kind of beyond the stereotypical version of that, and really the reconstructive side. And then eventually went with him to the Philippines in the district of Palawan to perform reconstructive surgical care for patients with burns and trauma specifically. Most of the patients were children. They're most often burdened, as well as women. And really what struck me, even beyond the compassion, care, and love that the entire team provided during that time, was the impact that the reconstructive surgeon had on these conditions that the patients were dealing with. They're extremely painful, impact their ability to lead their lives. And really, he was able to take this skill set that he had developed and use it to create meaningful change and impact for them. And I think seeing the need for it on a global perspective was extremely impactful to me. Now, after that experience, I continued to pursue medical training and education further, and that's really where I started to dive further into plastic and reconstructive surgery and burn care, and gave me an even better appreciation and understanding for the global burden of disease for burn injury, the significant need for reconstructive surgeons to be within these environments to provide reconstructive care, and the impact that would have. So since then, since that first experience within college and going through med school, and now it's just continued to be a significant passion for me, and something that I'm really excited to do.
Awesome. Thanks so much, Zach. Priyanka, same question for you. What inspired you to enter the medical field and reconstructive plastic surgery in particular?
Thanks, John. So I'm going to share a personal story. I actually never wanted to be a doctor. And when I was younger, I was training to be a professional dancer. And when I was 17, I injured my knee really badly during a dance competition, and was in a cast for 6 months, and ended up losing just all my credentials at the time, couldn't carry on dancing, and had to reimagine a different life for myself. And it was actually my dance teacher who said to me, have you considered plastic surgery? Because it really is the perfect combination between art and science. And so as a very naive 18-year-old, that's really what actually got me to pivot onto this path of becoming a doctor. But once I actually started training in South Africa, and I started realizing the need and the burden of disease that there really is, and how many people just don't have access to surgical care and reconstructive care specifically, that's really what got me interested in reconstructive plastic surgical care, and also the field of global surgery, which is really all just about trying to increase access to care for nearly 5 billion people in the world who we assume don't have access to safe, timely, and affordable care. So, yeah.
Awesome. Thank you for that. That leads me right into the next question. So a big part about this series is just kind of like, demystifying the more academic and research-oriented sides of the work you do, and really bring it to people so that they can understand, the world in which you work, and the really awesome things that you guys are doing for Operation Smile. On that note, Zach, in your words too, and thank you, Priyanka, for how you described it. Could you describe for our audience global surgery as a burgeoning field, and why it's so important that the world's philanthropic leaders and people in development really invest in this side of healthcare?
Thank you. Yeah, when people ask, how do you define global surgery? It's such a difficult thing to do, because there's so many different manifestations and way that people think of global surgery and how they become involved in it. But I think kind of at its core, global surgery can be thought of as a team sport, a collaborative effort through both international and local volunteers and contributors who are working together through partnerships, training and education exchanges, service delivery, and research to really achieve one common goal, which is strengthening and improving the surgical system surrounding the healthcare system, and really translating to increase access to safe, timely, and affordable surgical care. And this should be something that we are striving to achieve regardless of the location, financial status, nationality, et cetera, for these patients. So really this universal or global approach to delivering care where and when it's needed in the best way possible. And again, emphasizing that this is a collaborative team sport. We're all in this together, and nobody can do it alone or work in a silo. So that's perhaps the most important thing that all of us in the community really emphasize and focus on.
Awesome. And Priyanka, is there anything that you'd like to expand upon when it comes to global surgery?
Yeah, I think, everyone might be familiar with the Millennium Development Goals, and just how much the world started to really prioritize maternal mortality and infant mortality, and we, TB, HIV, so many communicable diseases that were put on the map during that period in time, and huge global health funding that was generated towards it. And in 2015, when we look back at our successes, we realized oh my goodness, we've left surgery completely in the dark. And now we've managed to solve all these other problems, and rightfully so, but surgery had been neglected for a while during that time. And so 2015 really was the pivotal point for global surgery, where landmark publications and global health leaders around the world started to rally and lobby for a call to action and for people to start prioritizing surgery on the global health agenda.
Definitely so important, and the reason why we're all here today, that's for sure. But yeah, Priyanka, we'll continue with you. Like I said, the title of this series is Why Research Matters. But before we delve deeper into each of your roles as Global Surgery Fellows, could you tell us why it's critical that a medical nonprofit like Operation Smile invest in the research that your team is leading?
Yes, and I'm sorry if you can hear construction in the background.
No worries.
But so when I think about why research matters, one of the famous Einstein quotes kind of comes to mind, and one that I really do live by. It's this idea that I'm neither clever nor specially gifted. I'm just passionately curious. And that for me is what research is all about. Like, we're all here because we are passionately curious about what ailments and what barriers our patients are facing in trying to access surgical care. We want to know about their struggles and how we can ease those challenges for them. And I think that's why research matters so much. It goes well beyond just graphs and numbers and percentages to really understanding, so what? Why does it matter that we're taking years, because research takes years to produce. And so why are we spending all our time really figuring out the precise numbers and trying to be accurate? And it's so that we can help and that we can make a much bigger difference, which is why I'm so excited that Operation Smile is really diving deeper into this area. And because they have, the organization has access to a population that is often overlooked in research because we don't have research capacity in many of the areas where we work. And so I also really appreciate that the approach being taken right now is to be incredibly collaborative and inclusive. So not studying populations, but including populations in local collaborators to better understand what are the challenges that your communities face, and how can we enable you and empower you to address those challenges and understand them better.
Well, we're so happy that you are passionately curious about this subject and what you're doing for people and improving people's lives. Thank you for that, Priyanka. Zach, same question for you.
Yeah, I think Priyanka does such a good job of beautifully stating it and emphasizing the impact that research has, and really why we do it, which is for the patients, for those who we're trying to reach out to and really go where we haven't gone before in a very powerful and meaningful way. And one of the things that Priyanka said earlier, which I think is an important statement or thought, is that medicine is both an art and a science. If you look at how far we've come in the past 100 years and what we do, really it's a constantly evolving field, and we are striving to advance the care that we provide to patients. And a large part of this evolution is indeed research. Research, if you want to break it down to its bare bones, is the study of things past and present, really in order to understand how things have been done, why we did them, and potentially how we can improve upon them through new solutions and alternatives to what we currently do. And this requires that, passionate curiosity and interest in going places we haven't before. And as an organization, Operation Smile, over the past 40 years, has really developed an extensive network of collaborative partnerships with many countries around the world. And something that Priyanka brings up is that the point of research is to really understand, in a given context, in a given location, what their challenges are, how they're currently doing things in ways that we can work together to lift up the local community, to lift up the local providers, and to deliver better care to those who live within those areas. As Operation Smile is very well positioned with its extensive network and infrastructure is developed during this time, and the partners that we have to make a very significant difference within the field of research, and to continue over the next 100 years to make those amazing advancements where we look back and just kind of really incredible to see how far we've come in the way that we can change the outcomes and progression for the people that we take care of and help. And so I think that it's a ever evolving process. It's something that is at the very heart and nature of medicine and what we do. And Operation Smile really has a very important and I think critical role that we can play in that, given our involvement within global surgery in this space over the past 40 years.
Thanks, Zach. And I think that leads us right into the next question I have for you, which is one of those ways that we may be able to revolutionize the way that we help people in places of need around the world. Your current focus is leading Operation Smile's team in the MIT NESTA Challenges Global Surgical Training Challenge. Could you tell us more about this project and how it has the potential to strengthen surgical systems in low and middle income countries?
Definitely. And this also goes back to some points that were made earlier, is that based off of that really landmark study in 2015, the Lancet Commission, and a lot of the work that's been done since then, they've been able to identify that currently there's around 5 billion people around the world that lack access to safe, affordable, and timely surgical care. Now, one of the big reasons for that lack of access for so many people is that we just don't have enough providers. And the current estimates is that there's over 2 million more providers that we would need to train and educate to be able to provide these critical, essential, life-saving and altering surgeries and procedures. And the current model of training and education uses often a direct mentorship model. So you have a master surgeon and then the trainee who works with them and operates and learn those skills. And that really is the most direct and historically powerful way to treat and train a new surgeon. Now, in order to address this significant deficit of over 2 million surgical providers, really it's important that we start to think of innovative new ways of reaching out and training new surgeons and also training new surgical techniques. And one of the ways that that's being proposed is that MIT, NESTA, and Intuitive Foundation have created this competition, this really call to arms to try and come up with those new innovative ways of teaching surgical skills, especially essential surgical skills that are particularly important and valuable within these resource-constrained settings. And so they are really creating a platform for us to develop free, openly accessible content and education materials for surgical providers around the world to learn essential surgical techniques. And they have allowed us to really pick whatever surgical technique or pathology we want to address. And while Operation Smile has an extensive history with cleft care, part of that is really training reconstructive surgeons to address challenging reconstructive issues. And when we say reconstructive surgeons, we mean those who are able to address significant wounds and injuries that arise from burns, trauma, infection, cancer, etc., and to restore form, function, and feeling to those patients who have lost that because of those injuries. And so the reconstructive surgeon is able to take their skill set and to use the patient's own biological, anatomy to reconstruct and restore what has been impacted by those injuries. And so we have looked at creating a platform that uses both a mobile app and a physical simulator that would be low cost and be able to be constructed with locally sourced materials to train providers in performing what we call local flap surgery. And so what flap surgery is taking a part of a patient's own skin and tissue that's adjacent or nearby the wound and rotating it or moving it in a way that allows it to cover that wound that has occurred, and in many cases restore the form, restore feeling there, and protects really critical components of the patient's livelihood. So in doing so, in creating this platform, we are facilitating the acquisition of really important surgical skills that allows providers around the world, no matter where they are, to use the app and walk through step by step virtually all the components of the anatomy, the critical steps of the surgery, how to manage any complications or issues that arise, and really how to think through the process of reconstructing these complex issues. And then also the physical simulator allows them to practice these skills with their own hands, and the simulator itself can be built with local products like local woods and hardware and fabrics to go through that step by step and get that physical hand-eye coordination and training for those skills. And really all this comes back to why we're doing this and the importance of this. And by learning this critical skill of performing local flap surgery, it's going to allow us to address the significant burden of disease from burns, trauma, cancer, et cetera, that affects tens of millions of people a year, causes fortunately many deaths, and also leads to millions of years of disability from lack of treatment for these conditions. So it's really us thinking of what we can do to help surgical providers learn critical skills that are extremely valuable to the world as a whole, and help them learn it in a way that's accessible, available to them, and something that can be done for many years to come.
That's super exciting, and congratulations on your advancement, the team's advancement through the challenge, and just the potential that it holds in the future is just amazing. So, Priyanka, I know this challenge also focuses on Sub-Saharan Africa, and with you being from South Africa, I'm sure that's really special personally to be a part of it. Could you elaborate further on the need that's present in the region and why this is so important, and why products like this are so important for healthcare providers there?
Of course. And I think it requires a little bit of explanation in terms of what exists on the continent. And again, there's been research that's published that have shown that most sub-Saharan African countries don't have any plastic surgeons. And so the surgeons treating those conditions are often general surgeons, they're non-physician providers, they're nurse assistants, people who have not been formally trained in plastic surgery, and they're doing the best they can with what they have. And to put it into further context, because you could say, well, why don't they just get the training? Or I'm sure they're doctors, why don't we just train them in plastic surgery? But there are very few ways to train in plastic surgery in the whole region. So unlike the United States, for example, where you have probably 80 different programs that will train plastic surgeons, in the whole region of Sub-Saharan Africa, there are probably only about 4 pathways to be able to train if you don't have your own local country program. And so that often results in people having to leave their countries to get training in other countries, and realizing that even with those skills, if they came back, they may never be able to use those skills because they haven't really been taught in the conditions that they're going to be serving in. So that is so profound. And then you think even further to how much surgeons might earn in Sub-Saharan Africa. And this might shock you because in some places it could be as $500 a month. Other places a little bit more, a little bit less. But you can see in comparison to high-income countries, Sub-Saharan Africa as a region has very little workforce capacity to support the delivery of plastic surgery care. So if we could just make it more accessible in terms of cost, in terms of just actual physical access, because many of these programs are still part of very traditional brick and mortar type structures where you have to physically be present to train. If we can transcend those barriers and those borders, we'll be able to train far more surgeons, but it takes innovators, and it takes those who again are passionately curious about how can we solve this problem with what we have, to develop virtual education training platforms like this. So I am so excited for this. I know that once we start really testing in countries, once we start getting input and feedback from our local leaders in Sub-Saharan Africa, that we'll have a much better idea of how this could be most effective, and hopefully inspire other teams, other groups to innovate in the space as well and create similar platforms.
Thanks, Priyanka. You bring up an important point about access. You know, it's the access for healthcare providers to receive the adequate training, but there's also the access to surgery itself. That's a major challenge for our patients and their families. And I know that much of your research centers around this. Could you tell us more about these barriers and how your work seeks to create opportunities for people to receive the care that they need and deserve?
Of course. So the barriers to care is one of the exciting projects that Operation Smile really focuses on, looking at what it takes for our patients, for our communities to reach care. You know, we assume that we're providing free services, but there are all these other barriers that patients, that providers face in actually not only seeking care, but reaching care and receiving care. So it's really phenomenal once you start digging deeper. You know, you follow the story of a patient who, with a cleft condition, who may not know the reason why they have that condition, why their child was born with that condition, may not even know that there's an opportunity or access to care, you know, and that really starts in the home. So being well informed and patient education is so crucial, and is not always done well in intense, high volume and low resource settings. And then we look at just being able to reach care. I mean, the conditions, the infrastructure is not ideal in many low and middle income countries. And so, you know, there are patients who are traveling hours just to get to care. They're spending a lot of their money, and often sometimes resulting in impoverishment of those households because of having to access surgical care. And then even when they reach the hospital, that hospital might be so overwhelmed that they may be put on a wait list that could take months, if not years. I used to work at a hospital where our plastic surgery waiting list was 7 years. And
Wow.
so, you know, how do you tell a mom and her little child that they're going to have to wait that long for surgery? And so it's so deep rooted and so entrenched in our health systems. And I think just starting to better understand the problem is such an important step forward. And I think that's why we're having this conversation today, is just to advocate for more research that can inform data-driven solutions.
Wow, 7 years. That's staggering to hear. That's yeah. So I understand you've also worked on some geospatial mapping and things of that nature. I know that that's kind of opening up a whole nother topic here, but could you explain what that means and how we're able to kind of determine where the people who need care live and how they can better access the care they need?
Of course.
I find it fascinating. So
yeah, well, I'm glad you asked, because geospatial mapping has become so part and parcel of when I do research. I find it so amazing to be able to visually map or see exactly where your problems are. And so if I could put it just really simply, it's a way to localize where you're seeing problems or where you're identifying challenges. So how we used it with Operation Smile is really to understand, if we're providing care in certain areas, where are our patients coming from? How long are they traveling to get to where we're providing care? What are the geographical limitations that they're experiencing? And where haven't we been that we should be going? Where are the underserved populations? So through geospatial mapping, you're able to layer different types of information. And so you're able to see that in these areas, these are the most impoverished populations in the country. And then on top of that, where are the patients with the most cleft conditions, or those who have the highest incidence of other plastic and reconstructive conditions? And then we can, on top of that, look at, okay, now that we know where our areas of need are, where historically as an organization have we been providing care, and has it been the most appropriate choice? So very simply, it's just an incredible way to kind of visualize the need in a country.
Awesome. Thanks for delving into that, Priyanka. Zach, we'll pivot back to you. So I know that one of your main areas of focus and what really drives you in your career is the treatment of burns. You touched on this a little bit earlier, but why is it so important for an organization like Operation Smile that may have its roots in cleft care that it also provides opportunities for medical professionals to address other essential surgical conditions like burns?
Yeah, I think it's an incredible question because it goes back to, I think, the heart of what reconstructive surgeons do and why they do it. And, reconstructive surgery is kind of, think of it as someone with a set of surgeries that they can do, a understanding of anatomy and the way that they can restore form, function, feeling after pathologies. And cleft care is one of those areas. It's a general condition that we have really focused on teaching providers how to address and to repair cleft specifically. But those surgeons are able to take that same skill set and other similar skill sets and understanding of reconstruction to many other pathologies, conditions that are particularly burdensome within most of the world. So, for example, burns, there's around 9 million burns that occur every year around the world. Over 70 to 80% of them occur in low and middle income countries. So there's a disproportionate burden on those countries. And the amount of disability that results from that is on the magnitude of somewhere between 60 to 80 million years of disability that are added every single year because of those injuries. And that occurs because these patients get burned, they don't get the care they need right away, and they develop scars that then tighten and contract across joints. It prevents movement, it's painful. It can also prevent things such as eating and speech, ambulation. And so these injuries aren't just affecting the skin for cosmetic purposes. They have a very significant functional impact.
Right.
And so by taking this experience we have training cleft providers and expanding it to the rest and the entirety of reconstructive surgery, which we already have done for many years and appreciate the impact of, it allows us to make a significant difference within many different areas that are particularly burdened, and even in children. As an organization has classically focused a lot on children, burns unfortunately are much more common in children around the world, compared to certain countries because of risk factors from environment and housing and childcare, et cetera, and the way that things occur. So it's already a population we're very familiar in helping and working with and very passionate about. And so being able to expand it one step further from just cleft reconstruction to all forms of reconstruction, especially burns, which have such a significant impact, it's something we're well positioned to do, something that we can make a very meaningful and significant contribution to. And so something I think is really exciting as an organization as we approach the 40th and expand really our vision for how we can continue to collaborate and be involved within this thing we call global surgery. It's something that really makes a lot of sense for us, and I think will be a really meaningful part of what we do as an organization.
Thanks, Zach. We're approaching the end of our time together here. So I was just curious, Zach, what's next for you? Or what are your future plans after completing your global surgery fellowship with Operation Smile?
Yeah, so after completing the fellowship, I still have 3 years of plastic surgery residency left. And then after completing that, I'll be doing another year fellowship where I'll focus specifically on burn care, doing both the acute care. So when someone gets burned and goes to the hospital, taking care of that initial injury, as well as getting certified in critical care, which means that I will be able to work in an ICU and hopefully run a burn unit where I would be able to be involved in the entire continuum of taking care of a burn patient from start to finish, from initial injury to therapy and reconstruction and recovery. And as part of that, because of this global work and experience with Operation Smile and the opportunities they provided, it's my hope that I can continue to work with Operation Smile to develop and expand the burn component, the rest of our reconstructive surgery and education programs, and also work with other organizations that Operation Smile has been associated with, like Shriners, where Dr. Billy McGee is out in California, and expand those other programs in different ways that we can reach patients that we haven't been able to before and help them in even more meaningful ways.
That's really awesome, Zach. Thank you so much for your service to humanity and bringing your talent to just improve people's lives, especially in such tragic circumstances as suffering a burn. Just really appreciate your heart for that work, and I know many people in the future will as well. Yeah, and best of luck too. Priyanka, same question for you. What's next?
Yeah, well, I am devastated to be leaving the fellowship at the end of the year. It's coming time to the end of my fellowship time, and it really has just been the most incredible learning experience, from the team of inspiring fellows that I get the opportunity to work with every day, but also the mentors like Dr. McGee that I've been so fortunate to have through this program, and Alan, who's taught me so much about research, but also the organization, just getting to interact with every staff member in the organization, both at headquarters, but also within countries. And that passion has been is really what will fuel me over the next few years. So I will go back to my general surgery training in January, but with hopes of then after that getting into plastic surgery and eventually into pediatric plastic surgery. But I am also hoping I'll be enrolling in my PhD this year to do more research with Operation Smile. So I'll be around. Yeah.
That's awesome. Well, we definitely really want you guys to stick around and would love to collaborate with you going into the future. And again, Priyanka, much like I said to Zach, I just wanted to thank you personally and on behalf of so many people for what you're doing and the effort that you're putting forth to help improve lives of people around the world who, of course, you may not ever meet, but it brings such a enhancement to their lives and their families' lives, and that kind of ripple effect that kind of radiates out from there is truly something special, and just wanted to thank you for your part in that. Great. Well, just one more. Just wanted to give you guys a chance if there's anything that we didn't cover here that you'd like our audience to know. Would love to give you guys a chance to have the floor. So Priyanka, if there's anything else that we didn't cover or that you'd like to say, now's your chance.
Yeah, I just wanted to say thanks so much for the opportunity to be able to share our stories today. We thought it was just so fantastic to be able to discuss why research matters and give you a little insight into what it's been like to work with the fellows. Yeah.
Great. Zach, anything else from you?
Yeah, I'll have pitch in here, and it's really about the fact that as you talked about, global surgery is this team sport, and I think at the heart of global surgery is humanity, right? And a lot of what we do is telling stories, and we do sometimes look at the big numbers and the impact we have, but also just as important is each individual person that we help. And the way that this works is through collaboration and through participation. Volunteers are such an important part of this organization, what we do, and global work in general. And I think for people who are watching, sometimes it's easy to think, oh, well, I'm not a surgeon or I'm not a scientist. I don't necessarily think I can contribute, but there are many different ways to contribute and become involved. And it's not just donating either. Donating is important and helps us do that work, but it's your time that is so valuable. It's being able to join organizations, whether it's for local engagements or international, to become involved and to see those stories and see how you can become a part of them and work together to really address this global effort that is, you know, addressing our humanity through how we provide care, and for us, it's through surgical care. So I think that it's exciting. It's something that so many people can become involved in a meaningful, impactful way, and it's always great to see a growing family of those who are compassionate about all this and what we do. So that's my shameless pitch there for everyone and anyone getting involved in what we do. There's always something in some way to help out.
Yeah, absolutely. And I think for me personally too, that's one of the driving forces behind, my involvement with Operation Smile, is just making sure people know there are these different ways to be involved, and that anyone can be an advocate for the work you're doing and for the well-being and dignity of our patients around the world. It can be as simple as retweeting or sharing a post, or making a financial contribution, or becoming involved on the community level. I think our organization just offers so many different avenues for people to make a difference. So I think that's really incredible. Speaking of plugs, Priyanka, how can the folks out there keep up with the work of the Global Surgery Fellows?
Yeah, well, thanks for bringing that up, John, because we're incredibly active, and actually big thanks to Zach, who really just mans our Twitter page. But I think as Zach was saying, it's just so important to know the so what, and we do our absolute best to try and take those scientific and academic findings and translate them into more meaningful, relatable one pages or little blurbs or excerpts, so that you can keep up with what we're doing as a team. And there are 10 of us now, so we're doing some pretty cool stuff around the world. So I'd love for you all to, it's at OS Global Surgery, and it's the fellows page specifically. So linked to our Operation Smile account as well. And so we'd love for you all to just keep up to date with the research, the talks, the conferences, and sometimes when we're in country trialing new ideas. That's where you can keep up with us.
Awesome. Thanks so much, Priyanka. Yes, that's at OS Global Surgery on Twitter for everyone out there. Please smash that follow button and keep up with the great work that Priyanka, Zach, and their team are doing. And again, thank you for joining us, and thanks to Zach and Priyanka for their time today. And just hope everyone has a wonderful rest of their day. Thank you.